Patologatorenadi Kashaya. You all know it is Kafapittahara. Kafapitta dominant, Kushtahara or Kushtagna. So as per this explanation, this is very much suitable for this type of presentation, right? For vesiculobular presentations or pus and all pustular lesions are there, or where you can call it like folliculitis type of or herpes type of presentations, right? It is very much suitable because it is Kafapittahara, Kafapitta Pradhana Kushtahara. Slightly, it is having a type of like what you can call Virechika property also, right? But very importantly, I use Patolakatrana Kashaya even in this type of presentations, like lichen planus or what you can call Kitiba, psoriasis, like different types of psoriasis also. And very importantly, with very good results. Very good results. Patolakatrana Kafapittahara, Kafapitta Pradhana Kushtagna. But where I'm using in the conditions that are Vata Kapha dominant and also getting good results. Right? Kafapittahara Kashaya in Vata Kapha Pradhana Kushtagna. How is this possible? How it is working? Namaste friends. Welcome to Dr. Mahesh speaking. Myself Dr. Mahesh Savalagimath. I'm practicing Ayurveda Dermatology since 2008 and teaching Ayurveda since 2008. Okay, so today we are going to discuss about the principles of Ayurveda Dermatology. In that, one important principle is the secrets of selecting internal medicines, the secret of internal medications, how we have to select the internal medicines. That we are going to discuss today, right? When we look into the text, like you read any book, like any Samhita you take, where Kushta is explained, or you can call Kshuddha Roga are explained, or herpes type, like Visarpa type of presentations are explained. Wherever we get the skin presentations, in all those, when we look into the treatment principles, what we see, almost all drugs are Pittahara, or Pittakapara, or Kapapittahara, or Pittavata. Overall, Pitta is given prime importance, right? Pitta is given major importance in the management of Kushta or any type of skin presentations, right? Why? Why it is given so much of importance? Why Pitta is given so much of importance? Right? We need to understand that. See, let us see the types of chikitsas. That three the chikitsa types of are there are three types. That one we'll see. We'll read the quotation, then we'll discuss how it is to be used in treating kushta or how it helps us to select medicines correctly in treating kushta. Right? Okay. Like Patologatorenadi, giving good results in Vata Kapha dominant presentations. Right? We'll see that. So as it says, Sharira dosha prakope khalu शरीरम एव आश्रित्य प्रायशः त्रिविधम औषधम इच्छन्ति अंतःपरिमार्जनम बहिःपरिमार्जनम शस्त्रपरिधानम चयति right three अंतःपरिमार्जन बहिःपरिमार्जन and शस्त्रपरिधान. Now what is parimarjana means what? Cleaning, right? Marjana means parimarjana, cleaning thoroughly, cleaning everything correctly. That is parimarjana. So antar parimarjana, cleaning from inside, बहिःपरिमार्जन, cleaning from outside, right? So antaparimarjanam yad antah शरीरम अनुप्रविश्य औषधम आहारजात व्याधिन प्रमार्ष्टि मतलब cleans away, destroys, or what you can call eliminates, neutralizes, right? Counteracts. What it does, shariram antapravish yad antah shariram anupravisha aushadam, the medicine that goes inside the body, then aharajata vyadim, means food is the main source of any disease, right? Including kushta. 90% of the etiology falls in the category of ahara. So the medicine goes inside the body, and whatever ahara jata vyadi inside, not outside. It's not about outside, inside vyadi. Now what it is presenting outside is not given importance here. What is inside, what type of presentation it is having inside, or what is happening inside, correcting that, is antaparimarjan chikitsa, right? Okay. Now what is bahi parimarjan chikitsa? Yat punah bahi sparsham ashritya abhyanga sweda pradeha parisheka unmardanaadair amayan pramasti tad bahi parimarjanam. So it is use of like whatever external presentations are there for treating them, bahi parimarjana ashrita means only skin dependent on, sparsham ashrita means it is bahi parimarjana dependent on completely on the skin outside. So like Abhyanga, Sveda, Parisheka, Pradeha, or whatever, so many other procedures like Darshana may be there or Udvartana may be there, something, anything like that. Okay, whichever we do on the skin are called as Bahiparimarjan, right? Shastra is directly, it is said, surgical intervention. Shastra Pranidhanam Punaschedana Vedana Vedana Dharana Lekana Utpatana Prachanna Sivana Kshara Jalokascheti. So it is application of surgical, parasurgical type, like Shastra and Anushastra type of prayer. Right? This is what. Now, what is the principle of internal medicine? That is Antaparimarjana Chikitsa. Antaparimarjana Chikitsa. But it says अंतरपरिमार्जनं यद् अन्तः शरीरम् अनुप्रविश्य औषधं यद् औषधम् अन्तः शरीरम् अनुप्रविश्य आहारजातं व्याधिं प्रमार्ष्टि. Means the medicine that goes inside the body and whatever ahar related pathology has been created inside the body, that is corrected by abhyantara prayoga, antaparimarjana dravya. Right? So what we need to understand here is, though the diagnosis of kushta based on the clinical presentations is important, it's very important. But what this says, it says find what's going inside the body rather than what it is presenting outside. अंदर कैसा है वो देखो, बाहर कैसा दिख रहा है वो नहीं, वो भी चाहिए. That also is very important. How it is presenting outside, that also is very important. But how it is presenting outside is completely dependent on what is happening, how it is inside. Right? How it is inside the body, it is dependent on that. Right? We need to think about that. Entire selection of internal medicines completely depends on understanding the pathology, internal pathology. Right? What is happening actually inside? That not lakshana. Vyakti we are not considering outside. Presentation we are not thinking yet. We have to think about why that presentation has come. Right? Now, what led to these conditions? Right? Here, hyperpigmented, dark, hard, thick lesions are there. Here, postural lesions are there. Here, scaly lesions are there, slightly oily, scaly. Here, vesicles are there. Here, thick, scaly lesions are there. Right? So, what is responsible for this? What led to these conditions? It's nothing but something very important that we need to understand, which helps in selecting right medicines in treating kushta. Right? Just think. I commonly use this simile for explaining this. Now, here we have a proper chapati. Here is a crispy chapati. Here is a bulky roti, soft, bulky, thick, and here is a fluidy type of. You can consider pizza or whatever it is, right? It is watery, right? So, what was responsible for it? What is responsible for these type of presentations, right? What is responsible? Where this can be altered? Where this can become this, or this one can lead to this type of roti or something, or it can become like this. From where it is dependent, it's dependent on the part cooking, right? How much, in what way it is cooked, depending on that, these are formed. These are nothing but the products of Paaka. Right? Similarly, this type of clinical presentations are produced. Right? Similarly, skin presentations are produced like this. So, what is responsible for these presentations? It's nothing but the Paaka that is taking place inside our body. Right? What is Paaka? Paaka is nothing but conversion. Conversion of any tissue, anything, conversion. Kushta itself says Kushnati. Matlab, the healthy skin gets destroyed. Why that destruction? Destruction is because of Paaka. How that Paaka is happening, what is responsible for that Paaka, that we need to understand to select medicines correctly, right? Antarparimarjan Chikitsa. Okay, as per my understanding, in my experience, when I go through these skin patients, whenever I study, I understood that these are the three main types of Paakas, right? That are responsible for varying presentations, right? But very importantly, as we know, Paaka is by Pitta. If Pitta is responsible for Paaka. But how that presentation, to what extent, how that Paaka is going to happen, that is dependent on association of Kapha and Vata with Pitta. How much Vata and how much Kapha is going to associate with the Pitta. Depending on that, the presentation will change or the Paaka will change. Hence, the product will be like that, right? So there are three. We'll see them one by one. The first one, here you can see, I have put a Paduka, we can call dermatitis, eczematous presentation. Like it is dermatitis or eczema, like oozing and all are there. Okay. Why? What might have happened inside the body for this presentation? For this presentation, there is pitta, right? There is more kapha, less vata. Pitta is rava, kapha is more. So what is happening here? Boiling type of presentation is happening. When pitta is there, kapha is there. Kapha is more, pitta is rava pitta, vata is very less. To do shoshana, to dry it, vata is less. So what happens ultimately? It is like boiling water. It becomes like boiling water. Hmm? So more drava pitta. So what will be the outcome? Oozing, pus formation, secretion, sava, suppurative type of presentations will be occurring because of this type of paaka. Right? Understanding here what is happening? The pitta is there, that's doing paaka. With that, with more kapha, and because of that, pitta also becoming drava pitta. Vata is very less. So that if vata is more, this dravata of the pitta and dravata of the kapha might have been dried up, shoshana ho sakta tha. But here what is happening? Vata is less. So pitta and kapha are more dominant. So it will become drava pitta, leads to oozing, pus formation, or whatever secretions, pustules, those type of presentations, right? So this is very important to learn or improve our, at least I don't know about other diseases, but improve our practice in Ayurveda dermatology, right? So if you are interested in actually improving your clinical practice by enhancing or updating your knowledge and skills in Ayurveda dermatology, then I have a lot of things to offer to you. Like there is a 30 hours course on psoriasis management mastery, 30 hours exclusive Ayurvedic management mastery and psoriasis. 20 hours course is there on dermatological manifestations of Visha. We call it as topical dermatology, means contact dermatitis, allergic dermatitis, drug induced, occupational, all types of dermatitis will come. So they are having different prices. If you buy them together, package also you can buy, like 7,000 discounted is there. These two are discounted, but yet if you mix them, it will become near 9,000. But if you buy together, it will be 7,000. Still, if you think like, you want to test whether I will be able to give justice to you for whatever investment you are supposed to make, you feel I'm not, you want to still validate that one, then there is a small 3 hours, pre-recorded workshop is there on application of the principles of Ayurveda dermatology, case-based understanding. Here also it's very elaborate, very useful. You can practice, based on that also you can start practicing Ayurveda dermatology. So it is just for 499. The links for all these are given in the description. Please make sure you visit them. Okay, 100% they are going to enhance your knowledge and skill and improve your dermatological practice or your overall clinical practice. Okay, so coming back to, if you have anything else to ask about them, you can WhatsApp me on 9845430626, or you can mail me at vaidamhps@gmail.com. Okay, so continuing with the Paaka. What we saw in the beginning, where Drava Pitta is there, Kapha is more, less Vata is there, right? Now here, Sasneha Pitta is there. Means Pitta is not that much Drava, less, little Kapha is also there. So little bit more Vata is there. So then what happens? It will become Sasneha Pitta. Sasneha Pitta. In these conditions, what happens? Scaling will start. When Shoshana starts, water starts drying, but because of the little Drava Kapha and Sasneha Pitta, it's not getting completely dried. So then what type of clinical presentations are found? Skin scaling will be there, but the scales will not be brittle. They are soft. You can roll them. Skin will become oily. Oily appearance will be there. Right? Soft, delicate lesion scales will be there. Right? So that is why it will be like this. If Vata becomes more, this oiliness will be gone. Scaly, but no oiliness. Right? So here what is happening? Vata is increased, Kapha is less, Pitta is there. So Vata got increased. So that is why the presentation is different. The third one, where Pitta is less or Pitta is Ruksha, more Kapha, more Vata, Ruksha Pitta. It's like burning coal, direct आग. गर्म पानी बोला था पहले, ये burning coal है. वो दूसरा वाला like ऑयल, तेल लगाया हुआ तवा की तरह, like pan with more oil, that type of presentation. But this one is like burning coal, it chars everything. So what happens here? When more kapha and more vata will come at that time, pitta, because of vata juksha guna and pitta jo ushna, that gets dried completely. Shoshana takes place. So then what happens? Ashanavat khatina. Acharya Sarka says khatina. The lesions become khatina. Khatina, khatina, khara, like that. Hard, rough, bulky lesions, thick lesions. Right? What is happening here? The Drava Bhaga is getting Shoshita by Agni and Vayu. Prithvi is becoming more dominant. Prithvi is becoming more dominant. So in all these, what is that is not changed, fixed, that is Pitta. So Pitta is very important in bringing the clinical presentations, whatever we see in skin patients. Pitta is the major cause. So along with that, how the Vata and Kapha are getting associated, depending on that, the clinical presentations vary. Right? The clinical presentations vary. So that is why whenever we are treating any type of skin disease, like mostly, like that is why I told you these are nothing but conditions caused by Paaka. Nature of Paaka is different, but ultimately these are the results of Paaka. What is the responsible factor for Paaka? Just now we said Pitta, right? So that is why even in Vata Kapha dominant conditions also, I am using Patolakatra and Adhikasha. You too can use, and it will give very good result. But here is something we need to understand. Like when I am telling, like, using type of presentations is there, Patolakatra and you use, no problem. So then externally also we need to be doing something. There it is directly indicated, okay, no problem. If it is hard one, consider the third part where the lesions are hard enough. So then what? Then what? Pitta Kapha Chikitsa. Vata Kapha dominant is there. I want to give Patolakatra. Now, what about that Ganatva? Then for that you have to use Google preparations, or you have to use Google Grita preparations, or Grita Yukta preparations, any Gritas, or instead of Patalakatrana, they can go with Gritas only. Again, Pitta concentrating. Pitta Kafara, Pitta Vatahara. Like Pitta Hara is very important. So that is why it is very important to understand what is happening inside the body. Right? Antar Parimarjan Chikitsa principle itself is the what you can call the main principle for effective selection of internal medicines. So what is responsible for skin diseases? The top secret, right? The top secret is, as it is there, beauty is skin deep. It's there, it's said, it's very famous quote. It is said beauty is skin deep. Matlab, whatever you do on the external skin, it's not going to work for enhancing beauty, complexion, color, and all. So it is inside, under the skin, beneath the skin. Likewise, for every skin disease, whatever may be the clinical presentation, the pathology lies inside. Pathology is also skin deep. So understand that what is that skin deep and plan the medicines accordingly. Okay. So thank you for watching this video. I hope I was able to give something new, new information, and hopefully it will update your knowledge and skills. And if you are new to my channel, please subscribe. If you feel it is worth watching, please like the video and also share with all your friends. And please don't forget to look into those courses. 100% they are going to benefit you. Thank you for watching. See you once again in another video. Take care. Namaste.